Okay, I think we'll begin then. Thank you, doctor. Oh, I think there's a little bit of echo. I'm not sure if it's just me who can hear it or.
Jaya, am I audible and visible? Yeah.
Just ask her, is it fine now? Just ask her, is it fine now? Voice is fine.
Is it fine now?
Yes, doctor, this is perfect. Thank you. Thank you. All right. Good evening, everyone, and welcome today to today's live. Wish you all a very happy World Diabetes Day. My name is Nupur Lalwani. I am a certified diabetes educator, and I've been living with type 1 diabetes since the past 27 years. Today, we are live through the Flipkart platform, and I will soon introduce you to our esteemed guest and diabetes expert. So, as you all know, diabetes is a huge public health problem today, especially in our country, in India. According to the IDF, there are over 77 million people that live with this condition, and we are a world leader. We're the second largest population in the world that has people living with diabetes. And the theme this year for World Diabetes Day is access to diabetes care. So, what does access really mean to all of us as people living with diabetes? That we should have our medicines, our supplies, and our diabetes education, all of these things available to us when we require it at the right time. There are a lot of myths and there are a lot of misconceptions around diabetes, and that's something we are going to try to explore today with doctors. So let me quickly jump in and introduce one of the most renowned names in the field of endocrinology, Dr. Ambrish Mithal. Dr. Mithal is a thought leader in the medical community today. He is an endocrinologist and the chairman and head of endocrinology and diabetes at Max Healthcare. Dr. Mithal has got several accolades to his name. He's Padma Bhushan awarded in 2015, and he's also got several other awards, the BC Roy Award by the President of India, and many awards, and publications to his credit. So we are going to quickly jump into the conversation. Thank you so much, Dr. Mithal, for taking out the time. It's wonderful to see you again. Thank you.
Thank you for having me here. Thank you very much.
Thank you. And to all our viewers who are watching, please keep your questions and comments coming for Doctor. So we will begin with the first, question for Doctor. So, Doctor, what is diabetes exactly? I mean, it's the most common. It's known as sugar or diabetes, and everybody knows about it. But really, what is it, and how do we diagnose it?
So you're right, actually, the definition of diabetes is based on a blood glucose value. So diabetes is synonymous with high blood glucose, high blood sugar, as we commonly say. Uh, why that high blood sugar happens is a different story. But yes, to call someone a diabetic, you need to demonstrate high blood glucose. How do we diagnose it? There are certain cutoffs. If we have a fasting blood glucose of 126 or above, and a post glucose blood glucose, that is, you give some glucose orally, administer glucose orally, drink it, and then 2 hours later do another sample, then that value of above 200 is called diabetes. So 126 fasting and 200 after glucose, that is diabetes. And we also use another criterion, that is something called an HbA1c, which is an average of 3 months blood glucose. And if you have an HbA1c of 6.5 or above, you are labeled as diabetic. But having said that, Nupur, I think it's important for people to understand another term that goes along with this, that is called pre-diabetes. And we all talk about it all the time. So pre-diabetes is something When your fasting glucose is above 100 and below 126, so 100 to 125 is when you are called pre-diabetic, or your after glucose value is between 140 and 199, then you're called a pre-diabetic, right? So these are the two zones. So 126, 200 is diabetes, 100 and 140 above that is pre-diabetes. And for HbA1c, the corresponding values are between 5.7 to 6.4. So if you're in that zone, below 6.5 but above 5.7, you are called a pre-diabetic. So pre-diabetic is also important because it offers you a window of opportunity to intervene and prevent yourself or your patient from becoming a diabetic.
Understood. Thank you, doctor. I think that was really simply explained, and any lay person like me or any of our viewers watching today will easily understand and remember what are the parameters. So, my next question, doctor, is when we are diagnosed or when somebody in the family is diagnosed, we immediately Google diabetes and we see a lot of scary things on the internet. So, what kind of complications can we expect?
Yeah. So the thing about diabetes, as you know very well, is that at the onset, it's often without any symptoms. So in general, it is thought that 50% of people who have diabetes don't even know it. Okay. So it's a good thing and the bad thing. The good thing is if you have high blood sugar, you have no symptoms. So you're feeling all right. And the bad thing is that because you have no symptoms, you tend to ignore it or not even check for it. The symptoms happen either when blood sugar is very high, we won't talk about that right now, acute complications, when you have sugars of 500, 600, more common in people with type 1 diabetes, which we are not talking about so much today. So classically, symptoms happen when organs get affected. When you have sustained high blood sugar, sustained high HbA1c or glycosylated hemoglobin, as we call it, of your body are exposed, they are bathed in high glucose. So gradually the tissues, the glucose attaches to the tissues and they start getting affected. So what tissues get affected? Any part of the body. But the more common and the more serious ones are definitely the kidney, the eyes, the feet, the heart actually also, along with other things, not just glucose, the liver. Now we know a lot about diabetes and the liver, and even things like bone quality and fracture risk. So, and there are others, but these are the areas that we talk about, or be positive about this. All these things will happen only if you neglect your diabetes. People with well controlled diabetes have virtually nothing. But that's very important to remember that all you read, diabetes causes this, causes that. If you neglect it, you don't manage it. I think it's if from day one, when you are diagnosed to be having diabetes, if you manage your diabetes well, and it's not just blood glucose. When I say managing diabetes, there is managing blood glucose, other things. I'll just explain that. If you manage your parameters well, you will not land up with most complications, hardly any complications, maybe one or two minor complications after many years. That is something we need to understand. There's a difference between controlled diabetes and uncontrolled diabetes. So when we say diabetes control in 2022, it does not just mean glucose control, although I emphasize that diabetes by definition means blood glucose, but it's a disorder of metabolism and it comes associated with its own partners in crime. So it doesn't go alone. So thieves work together. So diabetes, when you're managing diabetes, you manage blood glucose. That is, you manage the A1C. So that is the A of diabetes. You manage the blood pressure, which often accompanies diabetes. There are very large, high proportion of people with diabetes have blood pressure. That is the B, the blood pressure, BP. So you manage A, that is A1C. You manage B, that is the blood pressure, and you manage C, that is the cholesterol. So if you have all these three parameters, the A, B, C of diabetes under control, most of your organs can be functioning protected almost forever. That's very, very important to understand. First is, of course, control. It's about all these three. Along with that, of course, the D is you have to follow a diet, otherwise you can't do this. E is, of course, you have to exercise. All that is a given. I think one of the major things in type 2 diabetes is people often ask, what should I do? What should I? I said any formula for managing your body weight is what is going to protect you. Type 2 diabetes, 80 to 90% are overweight or obese. In Indians, it may not be gross obesity, it may just be central fat that we all develop. So, if you're able to maintain your body fat, your body weight, if you if you manage to do all those, you will only do it if you follow all of this that I mentioned earlier. So I use that in clinical practice to explain to patients. People ask, diabetes khatam ho sakti hai kya? Can I reverse it? This, that, all the said, वजन ठीक कर लो. If you can lose weight to come to target, it'll be okay. Of course, losing weight is not always easy, but the thing is that's how we have to approach. So those who can do
Thank you, doctor. It's
follow
really
these things,
reassuring to know that
they get
not everything that we see on social media
very
or
few
on Google
complications
is
of diabetes.
going to
So
come
that's the
true,
way we
or
have to
it's
look at
not
it.
going. It's not very bleak or depressing for people who are living with diabetes. In fact, when doctor was saying that as part of the ABCD and reducing weight is sort of closely linked with being able to control type 2 diabetes, and how important the role of exercise is. So that also brings me to another interesting thing that's happening now, which is the Flipkart Diabetes Free Run. There's this interesting initiative taken up by Flipkart where they've launched the digital marathon, and everybody who's watching right now and watches this later as well is encouraged to walk at least 6,000 steps. Take a photograph of your watch or your Strava or whatever app you use, and post it on social media. Don't forget to use the hashtag, which is hashtag Flipkart Diabetes Free Run. And it's not just about fun and exercise. Of course, that's part of a healthy life, but also this is going to contribute to insulin for children who cannot afford insulin, children who live with type 1 diabetes. So this is for a good cause. But I'm going to come back to the list of questions now. And the next question for doctors: how do I know if I'm at a risk for developing diabetes in the future?
So, given the way diabetes is exploding across the world, but in particular in South Asian countries like India or some Latin American countries, everyone is at risk. So, that is number one. So, some are more at risk, but anybody can get diabetes. If you let your guard down, if you're careless, you can get diabetes even if you don't have the traditional risk factors. But what are the traditional risk factors? We need to know quite clearly. Those who have a family history of diabetes, parents affected with diabetes, they are very likely to be more prone or to get diabetes if they are not careful. Number one. Number two, weight. Weight is the most important risk factor for diabetes. We already emphasized that. So, family history, weight, then, of course, associated things if they're happening, if you have high blood pressure, if you have lipid abnormalities, you're not a diabetic but you have a cholesterol problem, you're again at risk for developing diabetes. People who are like some colleagues, and sometimes we just sit on the chair. If you're not careful about moving all the time, every half an hour or so, sedentary people are at greater risk of developing diabetes. Women who had polycystic ovarian disease as girls, as adolescents, they are clearly at greater risk. People who Women again who have a history of diabetes during pregnancy which went away, or just had large size babies, large babies, all those people are at risk. But as I said, anybody who's overweight is inactive, is at risk. So I do think that we should all be cautious. The way, as I said, the prevalence is so high that no one can say, yeah, I'm not going to get diabetes.
Absolutely.
So we
And
should be
doctor,
careful.
are there any warning signs for highs and lows, or how do we like figure out, when is a good time to check?
So clearly, some people, and that happens when sugars are really high, and we get, of course, that's common in type 1. That's a norm in type 1. But in type 2 diabetes, that happens only if sugars are high, and that is increased thirst, increased urination, frequency of micturition, we call it, and large volumes of urine, getting up at night to pass urine suddenly, which wasn't there earlier. Sometimes changes in appetite. Increased appetite can also be a feature of diabetes. Weight loss. On the one hand, you think your appetite is increasing. On the other hand, you feel you're shrinking, you're losing weight for no real reason. Some manifest with vague symptoms like, calf pain or pain, general tiredness and fatigue, especially towards the evening hours. Some present with blurred vision, visual problem, that suddenly vision is becoming blurred. Some may present with an infection, not uncommon, skin infection, not healing. Coming to the hospital with an infection suddenly, and you find, genital infection that you didn't have earlier, and you were checked, you found to have diabetes. So there can be a very varied presentation. But remember again, many of you will need to just test if you are at risk, if you are overweight, if you have a family history, and all the factors that I mentioned. It's important to test in the West. They say at 35. The ICMR in India recommends start testing at 35. The ICMR in India recommends start testing at 30 annually, or that you can discuss with your doctor, but you must test. And many experts are now saying, seeing the exponential rise in young patients with type 2 diabetes, that even the age should be lowered to 25.
Thank you for that reminder, doctor. And for
So,
all our viewers, if you are,
that age
over
cutoff.
the age
So
of
you
25 or
must
30,
test even if you have no
definitely get
symptoms. But if
yourself
you have any
checked,
of those that
irrespective
I
of
mentioned,
symptoms.
quite clearly you need
Doctor has
to
also
get a
shared
blood glucose level done.
symptoms that you can keep track of. Doctor, what advice would you give children and parents of children living with type 1 diabetes?
Yes, type 1 diabetes, of course, Nupur, as you know very well, is a different story altogether. It is the classic variety of childhood diabetes that comes on acutely and is primarily because of insulin deficiency with very little component of insulin resistance at the outset at least. And therefore, such people and such children have to take insulin. So the first thing I just told you that you have type 1 diabetes, you must take insulin. Don't run away from insulin. Develop a friendship, a partnership with insulin. Don't, try advertising that tells you to give up insulin and tells you that type 1 diabetes can be cured. Unfortunately, it's unregulated and all over, and I'm just so fed up of countering that all the time, that no, please don't stop your insulin if you have type 1 diabetes. Maybe you can reduce your insulin dose if you're going through a honeymoon phase. No cure in the world at the moment for type 1 diabetes other than giving insulin. And experimental therapies like islet cell transplants or pancreas transplants are for discussion with your doctor, but not for common. How to give insulin? Either by multiple injections or by continuous infusion, by using pumps, all those things should be discussed. But the bottom line is, do not stop your insulin. It comes as a much greater shock than type 2 because it affects much younger people. And therefore, it's almost like a lightning has struck a family, like parents, as you said, and the child. I think a positive approach really helps. If I were to stratify my type 1 diabetes patients, those who first challenged the diagnosis, those who were not convinced that insulin is the only way, they wasted time, they wasted money, they had psychological issues, and they did not do so well. But those who were more aware or more accommodating, you and understood the problem, not necessarily on day one, but within the first few weeks, they've done remarkably well. My friends who were diagnosed when they were preparing for pre-medical, and they are now retiring as professors, and they have no complications. And there are so many examples like that. So the use of better technology, if you have access to it and can economically afford that, the use of sensible, devices that will allow you to take sensible decisions, listening to your doctor, but also taking charge of your own body. Of course, there is some restriction. If you have type 1 diabetes, it'll be a lie to say that everything is normal. No, you will have to have, as I said, insulin in some form. You'll have to eat on time. Try to eat on time. Try to adjust your dose of insulin to what you're eating. If you're willing to do all that, I think you can have a great life as a type 1. You can do anything. I mean, I can't name here, I don't want to name, but so many people have come out of the closet and declared their type 1 diabetes. Famous actresses, famous athletes, I know of so many famous doctors, people don't know, who have done remarkably well in their life. So, except for like being a pilot or in the defense forces, except for a handful of professions, and I say that because got selected for the pilot. So between that, he got type 1 diabetes. So that is, of course, a shocker. But if you leave out those selected professions, you can do anything. You can be a doctor, engineer, a bureaucrat, whatever you like. Management person or lawyer, whatever. So nothing should keep you down. It is if you choose a good doctor and a team who's experienced with this kind of thing, you'll have no problem.
Thank you, Doctor. I also want to really thank Dr. Mithal for his advocacy and support always. On Twitter, I always see you mentioning the same thing that you just said, that, for type 1 diabetes, insulin is the only answer. Whatever information you find out there, there might be, something to the effect of which kind of tells you that insulin is not required, but insulin is the only way to stay alive for people with type 1. And of course, doctor shared wonderful examples of how they can do anything. And me as well, I've been type 1 for 27 years, and from day one until now, a few hours ago, I've been taking my insulin shots. So thank you, doctor. Doctor mentioned, the A, B, C, D, and I want to kind of touch upon the B and the C part, the blood pressure and cholesterol. How do we kind of take care of that with diabetes?
So, with or without diabetes, they should be taken care of. But with diabetes, it becomes exceptionally important because one of the major long-term complications of diabetes that can even, sorry to say, but prove fatal is heart disease. And heart disease is not managed, for example, prevented by just treating diabetes, just treating glucose. You must. You will also now be encouraged to use anti-diabetic drugs that actually reduce SGLT2 inhibitors and technical part. But the fact is that there are new diabetes drugs in the last 5 years or so, which have proven to be exceptional in preventing complications. So you have to treat the blood pressure, the blood glucose. You have to treat the blood pressure with whatever medication is required, and you have to treat the cholesterol. And I think there is also another whole media upsurge about not treating cholesterol, and the whole thing is fake. And the Americans have dropped it, and Indian doctors are chasing it, which is all a crap of this is utter crap. This is utter nonsense. The fact is that when you're treating diabetes, and if you have a lipid abnormality, cholesterol abnormality, or you are at high risk for heart disease for various reasons, then a statin, if advised, is a must for type 2 diabetics. Do not run away from statin. If you're in that small proportion of patients who gets a side effect with statin, then that's a different story. Talk to your doctor. But most people don't. So since most people don't get side effects, those, if they don't take a statin, if so advised by the doctor, and if they are candidates for that, and continue to just manage their blood glucose in the hope that everything will be all right, then that's not being very smart. So please don't let the media drive your treatment. Let the doctor drive your treatment.
Absolutely. Thank you, doctor. Another question, doctor, about back to when people Google things, or when they look up things and they find online, photos of an amputation or something really scary visually. What is your advice? How do we take care of our feet and eyes?
I think for eyes, it's fairly straightforward. If you control your blood glucose and blood pressure well, the eyes will largely be safe. But even if you're normal, like everything is okay, you need to get an eye check done once a year. That is mandatory. Sometimes patients, my eyes are fine. I don't want to go to an eye doctor. I don't want to get a fundus photo done. You don't always have to go to an eye doctor. Even an optician can take a fundus photograph, not a check for refraction. Okay, that's very important. So once a year is mandatory, even if everything is fine. For feet, every time you visit a doctor, you should take off your shoes and make sure the doctor sees your feet. And now there are tools which we can use, like bioacousiometry and others, or a microfilament that will actually happen. But let me tell you, food complications don't happen, amputations don't happen in people who are following the basics. I mean, it's a very clear difference in amputation rates between patients who are not aware or neglect their diabetes versus those who are actually following things. So again, amputations are a sort of not a very pleasant complication to have, and they're pretty ghastly when you see those images, as you say, Nupur. But it's completely avoidable.
Thank you, doctor. It's
Completely
been
avoidable.
really nice to know that we don't have to be, things don't have to go south. There's a lot that is in our control, and we can take charge. So the last two questions, very quickly. So the second last question is, what advice would you give the caretaker of a person with diabetes?
I think that's a great question, because that's the challenge we face in our chambers all the time. Uh, Firstly, the blame game shouldn't happen. Very often, I find that the caretaker, with all good intentions, is actually blaming the person for all the ills that happen. And when you look physically at the caretaker himself or herself, they are actually equally unhealthy as the person with type 2 diabetes. They just don't have high blood sugar yet. So, what the most important part is, diabetes is a family, community, and state problem. So, while the individual has to exercise discipline, it's incredibly important that the whole family follows healthy eating. For example, because we don't think there's anything called a diabetic diet, it's a healthy diet. So you can't expect to have all sweet meats lying around and everything on the table, and expect that person to refrain from everything. So the whole family should change their eating habits, take this as a positive way to improve everyone's health. And I think that is a very important message for the caretaker. If it's a man and the woman is looking after, the wife is looking after the kitchen and the general running of the household, it's very important for her to understand that everyone's diet should change. Mothers often feel, no, no, my child will be deprived of sweets, it doesn't matter. It's good for the child. So, whatever changes you make for the patient, there may be some specific changes, of course, as per doctor's advice, but the general eating pattern of the family should change. And please don't blame or be prescriptive all the time to the person who's affected. There's no one is actually going to follow, or it's not going to register if you are saying, you can't do this, you shouldn't do that. It doesn't work like that. You have to understand. I know it's hard, but you have to understand, and you all have to follow that. Then it works. So, like other way around, I've seen husbands blaming their wives for, I go for a morning walk, why can't she come? I mean, that's not good enough. maybe she has too much work, maybe she has too many things on her. So every individual has to be dealt with sensitively, and I think that will
Thank
work.
you, doctor, for
That
these
will work.
pearls of wisdom and really practical tips that I think anyone can relate to and anyone can follow. And one thing that doctor you said about how the whole family needs to change. I think that's really so important. That's my takeaway from this answer that you shared. And also, for all our viewers, there are free HbA1c tests that Flipkart is giving out. So you can go check out their app, and please utilize this for the entire family for their benefit. Get them tested. Like doctor mentioned earlier, diabetes is not always something that comes up with a big symptom, so it might be there silently in the background. With that, I reach the last question, doctor. What are some of the big myths around diabetes? Maybe one myth that you'd like to sort of bust.
Well, one myth is that my medications are worse than the disease. And if my organs, people who take medicines are fearful of initiating because they think they'll get addicted, or they think that medicines are going to damage their organs, all kinds of things. And I think taking medication for diabetes is not a fear. Taking medication for diabetes is not a fear. Your doctor will tell you, please follow that. None of the medications that are licensed to be used in diabetes are actually going to damage your organ. But at the same time, every medication can have some minor side effects. Some may have more than that, but that the doctor is aware of. And our treatment plan is based on monitoring for the side effects also. Rather than blindly letting it go, let the sugars be high. And I am not going to take medicine, manage diabetes on my own. It's a good thought, but look at the numbers. Diabetes is, patients tell me, अब तो हमारे खाली नंबर्स देख के बताते हैं सारे डिसीजंस. मैंने कहा that's right, that's how it is. So very important, don't fight the medication, fight the disease, fight the malady. I think that's very, very important. Don't be scared of medication, trust your
Thank you
doctor.
so much, doctor, for saying that, because I think that is a really common question that comes up, and thank you for addressing it. So thank you, Dr. Ambrish Mithal, once again for this enlightening session. It's been a great reminder for me as a person with diabetes, as well as for all our viewers, I'm sure. Thanks once again for taking out the time, and have a good evening. Thank you, doctor. Bye bye.